providing treatment which is otherwise unaffordable for people who can't afford to pay. It's very costly treatment, and has become all the more difficult because of the intellectual property regime that we are passing through. Of course, India had till 2005 basically what we call process patenting and not product patent, but 2005 amendment to this our patent act has been product patent also applicable for India. And in spite of that, the thing that I can be proud of is that India is the country that has been supplying antiretroviral drugs to most of the developing countries at much lower price than any other country, I mean the multinational corporations included. But there had to be a system where this is made available to everybody who need it all over the world. We have so far been able to start antiretroviral therapy in Kolkata, but we've been trying to extend it to the North Bengal also. And mother to child transmission, treatment for preventive purpose has already started earlier, and we are trying to scale it up right now. West Bengal continues to be one of the low-risk states as yet, because we divide the states in India to high, medium and low risk in India, and West Bengal continues to be low-risk state, though there is no scope of complacency taking the trend of the epidemic and the way it is spreading world over. We don't think there is scope of complacency. I don't think I would take much of your time about talking about the sets and all that, but the only thing that I can submit before you is that we're very glad to know that you are expanding your activities in Kolkata and the surroundings, particularly in the sphere of health, education, employment. Very important interventions that you have made. I'm really grateful for the effort that you have taken, and I can assure you that the government, with all its might, to be with you to see that whatever help, support or assistance that you need are made available. But we believe that it's not only the fund or this financial resources. Most important is human resources. That is something very important. We're very glad to see that our sons of India, daughters, sons, what to say, are available, and so we are in depth of human resources, and I believe that there's also a good contribution towards that end. And I would end by saying that your activities, I believe, and it's not your activity, it's our activity, your and our together, will help to strengthen the relation between two governments, two countries, and two people further. Thank you.
So actually the genesis of this goes back to our future speaker here, Dr. Bobby John, I met in Washington, D.C., where we lobby every year. His first visit to out of India. And he said, you could spread advocacy further through the Indo-Canadian community. So that stayed with me. And I have the results group in Calgary, where I live. And we have a number of Indo-Canadian community involved in our group. And Dr. Banerjee knows the Chakrabortis, Arun and Utan very well. And so he was working with us, and he connected me with the folks here in Toronto and spawned this event. So a little bit about results. We're a grassroots citizens advocacy group creating a political will to end hunger and absolute poverty. And so we don't do projects in countries. We're about lobbying our government and lobbying the international financial institutions like the World Bank and the IMF to get more funding and changing of policy so that the people in the field can really do their work. And so we're about eradication of poverty, and so we do a number of things. So we've worked on the Global Fund. This is a slide on the work that we've done on the Global Fund. And our government has, again, this year announced $250 million towards the fund. So, I mean, it's very interesting that we're not a big organization. We've got groups across the country and, just are getting educated as, citizens of this country, educating ourselves, learning to write letters to the media, visit our MPs, and write letters to our MPs that, we get this kind of money out of our government from a few people. So, we're here tonight to further educate ourselves on the whole Indian situation as well as what's happening in Canada to further advocate. And you out there that would like to support us, make sure you talk to us afterwards or pick up one of our brochures. Tuberculosis is a disease of poverty. So, of course, that's something. And it was very interesting. I mean, we can track, once we got involved in starting to lobbying, the funding from the Canadian government started to go, saying we're saving 250,000 lives every year of the funding that we do here in Canada. Education, obviously, root out of poverty, big time. And they invited UNAIDS, WHO, people working, because it's this co-infection between TB and HIV that, really was that highlight in where they were reporting on. So, Dr. Tomanathy is head of the Division of HIV/AIDS at the TB Research Center in Chennai. And I'll introduce David Hawkins later. If you'd like to say a few words.
Thank you for all of you for having us, invited us over this evening. I work at the Tuberculosis Research Center in Chennai. It's a 50-year-old institute. It's one of the institutes of the Indian Council of Medical Research, and our focus has been on TB for the last 50 years. But of course, for the last few years, we realized that TB and HIV go hand in hand and very closely together. And so more and more of our time is now spent on working on HIV and TB. And let me just give you an example of a typical scenario that we would see in a clinic on any given morning. There would be a husband and a wife and a child who would walk into the clinic. The man would be looking thin and miserable and obviously ill, and he would be running fever, maybe had cough for a couple of weeks. He's been going from one private doctor to another, taking medicines. Sometimes there's a history of diarrhea and having weight loss over the last several months. The wife very often is pregnant when she comes, or she's recently delivered, they have a little baby with them.